What is going on, Wellness Gang? Welcome back to Embodied Wellness Radio, a podcast framed around making women healthy again. And today I am very excited to be chatting with our incredible guest, Dr. Ashten. She is a naturopathic doctor that is currently practicing in London, Ontario, and she loves to focus on complex chronic illness. So everything from autoimmunity to mold illness, and really things that are hard to treat in the conventional medicine space. And today we're going to be talking about an issue that is actually quite common. And I've personally experienced this. I have seen this in a lot of clients, and I believe that it's not talked about enough in the health space, and that is histamine intolerance. So thank you so much, Ashten, for coming on today's show.
Yes, thank you for having me. I'm happy to be here and talking about some of the things that a lot of people actually struggle with. And hopefully, we can help shine some light and guide them in the right direction. So, thank you for the wonderful bio. I'm happy to be here.
So a lot of the time we hear about histamines when people take an antihistamine for something like an allergic reaction, or a lot of people take them, chronically during allergy season. So what actually is a histamine?
Yes, so a histamine is like a signaling molecule that is thought to be a neurotransmitter that helps mediate the immune response. So when everybody thinks about histamine, they think about the allergic reaction, right? They think of hives, itchy, watery eyes, sneezing, the allergic response. And they're released from the mast cells, but also the basophils. And these are different types of immune cells in the body. And it's used as a defense mechanism to kind of alert the body that something is trying to harm them. So it's like a defense mechanism to let your body know that there's something wrong.
Awesome. And so what role do they play in the body aside from allergic reactions? They're involved a little bit in inflammation, regulating stomach acids. So as you mentioned, they're involved in allergic reactions, but do they actually have a helpful role in our body?
Oh, for sure. Yeah. So initially, because the body is very smart and it has roles for things, it wouldn't just give you histamine just to be harmful to yourself, to punish you for being in contact with something that your body is sensitive to. So histamine, you mentioned it does play a role in stomach acid. So it actually increases the release of stomach acid, which will help break down things like proteins, which also is like inflammatory markers, cytokines, things like that. And histamine also increases the permeability of blood vessels. So it allows the immune cells to reach the site of injury. So if you're hurt or anything, and it's a part of the inflammatory response, because initially inflammation is good, right? You want inflammation when you are hurt because that brings white blood cells there to help promote healing. So it's a part of that initial inflammatory response, but then it becomes more problematic when the inflammation doesn't go away. And it's used for tissue repair, defense against pathogens. I mentioned the stomach acid helps break down proteins. It also has other functions, like I mentioned before, the neurotransmitters, which histamine, when it's high, it promotes wakefulness. And then as it decreases, then that may induce sleep. So it's similar to cortisol, whereas cortisol is good, where it wakes us up in the morning and we need it to survive. But then it's a problem if cortisol stays around too long, similar as histamine. So it differs from person to person based on their tolerance and their state of health. People often think of like brain fog when it comes to histamine, and that can definitely be a symptom of something called, air quotes, histamine intolerance for sure.
Right. So that leads us into the next question of what is histamine intolerance?
So histamine intolerance is basically when a body can't tolerate histamine. It's pretty self-explanatory, but there's lots of symptoms that go with it. That can include things like headache, fatigue, dizziness, cognitive difficulties, like the brain fog I was mentioning. And histamine intolerance is when there is a problem with breaking down histamines, ultimately. It's different than mast cell activation syndrome, which we can definitely talk about. But ultimately, with histamine intolerance, it's an issue with breaking down histamines.
Right. And there's an enzyme called the DAO enzyme, which helps to break down histamines. And a lot of the time when people experience histamine intolerance, they can be deficient. Personally,
Mm.
when I was doing my schooling for FDN, we actually ran a lab that showed DAO in relation to histamine in your body and histamine intolerance. And I had dealt with histamine intolerance for a while. I had chronic eczema growing up my entire life. I went to so many dermatologists and I was just given topical steroids, take an oatmeal bath. take your little Aveeno bath and
Ah,
like chamomile lotion on it or whatever it was, and nothing helped. And it was at the point where my eczema would crack and bleed. I had to stop playing sports. It was so bad. And when I started going to school for holistic nutrition, I learned about histamines in our food, and I was like, whoa. So I went on a low histamine diet, and my symptoms improved drastically. At the time, I had
mhm.
also moved to go to school, so I moved out of the place I was in when I was younger. We're not going to go down that rabbit hole, but out of like a moldy place that I grew up in. And really, it was like quite incredible to learn about this and just see all the systemic effects and kind of dive deep into that. But with the DAO enzyme, it's actually made in the intestine. So a lot of the times we'll see people who have histamine intolerance also have a lot of digestive issues, sometimes things
Mhm,
like intestinal permeability, low secretory IgA. But when I was diving into it, I also learned that medications can decrease DAO. So
mhm,
one that I see quite often in my practice is clients will have period pain, which again can be related to histamines, and then they're taking something like a leaf, which is also
mhm.
increasing your DAO production. So now it's like, okay, we already have this intolerance, and now we're kind of making it worse. So I think, yeah, really like working with practitioners who understand the complexity of these things is important because it's never just a histamine issue. It's never just, a skin rash. We really need to look at everything going on in the body and understand like how these things like histamines really work and regulate themselves and what we need to do in order to break them down. So maybe you want to just talk a little bit about the enzyme that breaks it down and some problems people can have there.
Oh, absolutely. And like, I love that you kind of brought that into place because it's so important. And also, I look at gut health primarily because that's where the DAO enzyme kind of lives, the diamine oxidase enzyme. And that is the main enzyme that breaks down histamine. And we can see a deficiency. I'm glad you brought the medications in because I was going to bring it up as well, because things like NSAIDs, like ibuprofen, Advil, things like that, acetaminophen. There's also some other medications like different immunomodulators and cyclosporine, and even some SSRIs, which is interesting. That brings in kind of the gut brain axis that's happening. And that if you have dysfunctional gut dysbiosis or anything that's happening funky in the gut, then that can cause more mental symptoms like anxiety, depression. And I'm curious if that was actually a histamine thing from the beginning. So diamine oxidase breaks down histamine. So we all absolutely need to look into the gut. Some people may supplement with the actual DAO enzyme. It's very difficult to find in Canada nowadays. It's been back ordered, and I just really struggle to find that for patients. So it's very difficult. So ultimately, if we can't supplement with that, we need to quench the flame of histamine ultimately. Quenching the flame of histamine is difficult because it's like a wildfire. And once it catches wind of something, then it just continues to bloom. And we need to bring that back down. And sometimes, because even though I'm a naturopathic doctor, some people don't appreciate when I recommend over the counter antihistamines. However, they're there for a reason and they really do help. Now, there's different generations, first generation, second generation antihistamines. There's Reactin, and there's things like Benadryl. Reactin is one of the more safer long-term antihistamines that even allergists will recommend, whereas they're kind of shifting away from Benadryl because Benadryl will cross the blood-brain barrier, whereas Reactin will not. And ultimately, they both decrease histamine. And at the same time of doing that, you can pair it with mast cell stabilizers. Like I mentioned before, histamine is released from the mast cells and also the basophils. Mast cells more primarily than the basophils. So that's why the focus mostly is on mast cells, but ultimately stabilizing them so they don't degranulate and make more of this histamine. And there's things that can do that, like EMIQ quercetin. You can also do regular quercetin, but EMIQ is just better absorbed, and you need less of it to have more of a systemic effect. High dose vitamin C, perilla, stinging nettles. Stinging nettles is highly underrated, by the way. It works beautifully to help
Love
stabilize and take
metals.
away, yeah, take away the itchies. It's great. So doing that alongside with possibly the over the counter antihistamines seems to be very effective of managing the histamines. And once we kind of manage the histamines, then we can start building that gut back up, and kind of regulating the immune system as well, whether that's with different botanicals. And you also need to be careful with the gut because a lot of things that are known to be good for gut health This is more so specific to mast cell activation syndrome rather than true histamine intolerance, is that there are some good things for the gut that can worsen the condition. So things like collagen, things like bone broth, things like glutamine. These are all things that can actually worsen the condition because they influence glutamate, which are excitatory and cause the cells to degranulate. So it's really interesting.
Yeah, even fermented foods. Like when I was going through a low histamine diet, I was like, oh,
Mm-hmm.
all of these quote unquote health foods are actually making where I'm at right now a lot worse, my symptoms. So, like a low histamine
Mm-hmm.
diet, maybe we can talk a little bit about that. Sometimes acutely, as we work on obviously addressing the root cause of histamine intolerance, can be really, really helpful for managing symptoms. So, off the top of my head, I think the biggest ones for me that I was eating all the time were strawberries,
Mm-hmm.
spinach, cashews, fermented foods. So things like kimchi and kombucha and sauerkraut that are really great for gut health.
Mm-hmm.
Chocolate, I personally don't drink, but alcohol for a lot of people is a big one. And leftovers. So it really
Aha.
is like, I always consider histamine like a bucket of tolerance. And in the beginning, if somebody's really symptomatic, we do want to empty out the bucket as much as possible. But as we work on improving somebody's health, of course, their histamine bucket can improve. So they might be able to eat a little bit of leftovers, but it could be like the leftovers that has the spinach and has the citrus foods and has, cashews in it and we're really just overflowing the bucket. So, do you personally use low histamine diets in your practice?
Yes, I do. And that depends on the person as well, because they can be quite restrictive and decreases people's quality of life, especially if you're doing them for long term. So I usually recommend that people just cut out, like I'll do a 24-hour diet recall, sometimes a 7-day diet recall to see what they generally eat. And if there are any really high histamine foods like avocados, bananas, things like that, then I might say, let's try and take those out and just see how you feel, right? Rather than just doing everything bare bones, you absolutely can. And some people are willing to do that, but some people are absolutely not. So taking those away and seeing how they feel is kind of a key indicator that there is a histamine problem going on, rather than just recommending a whole bunch of supplements right off the bat, because people don't want the pill burden and they don't also want to feel like they're just being sold a whole bunch of supplements. So let's try and work with the diet. It's free and see if things get a little bit better. The leftovers is also interesting. Glad you brought it up because a lot of people love to meal prep because it saves them a lot of time. To save people on that, I usually recommend them just freeze their food. If you freeze it, then it's not sitting because the longer the food sit, the more the histamine builds up. And that's
Mhm.
where it kind of comes into play, where a lot of people with the histamine intolerance can usually tolerate leftovers that are like the next day. It's when it gets to day 2, 3, 4, 5, right? Depending on what they're doing. All the bodybuilders out there used to compete in competitive bodybuilding where you'll eat on day 7, still eat the same chicken and broccoli that you made the Monday before. So
And
things like
no,
that.
no
Yeah.
coincidence, those are always the ones with gut issues too.
Yep. So, yes, I find depending on the window of how long the leftovers are made, and then also freezing them and reheating them, usually there's no histamine problems too, and you can still meal prep so you don't save time, stuff like that. But yeah, I definitely use a low histamine diet when there is cases of histamine intolerance or mast cell activation syndrome.
hmm And I think it can be a really great way to kind of give us clues into even if somebody was wanting to do a test, you run tests, I run tests, but I don't always think that they're necessary and definitely not the first thing I do for clients. Like you might see this in your practice where I have people come and they're like, everything's off. I want to test my hormones. I want to test my gut. And I'm like, okay, let's take a deep breath. Like if you want to invest $1,000 right now to run all these tests, that's totally fine. But until we've really worked on like nutrition, stress management, moving your body, nourishing your body, getting enough sleep, like I can already tell you that we have a lot of big needle movers to work on before we even think about spending any dimes on testing. And I think that, things like you mentioned, like they're free things that we can try that can really be very helpful to guide treatment and to also like help guide where clients may want to invest their money or if it's even necessary. And I love
Mm-hmm.
that you brought up too, like people don't want to be sold a bunch of pills because I've even found in the naturopathic space, unfortunately, like some
Yep.
naturopaths are just practicing green pharmacy where I have clients come to me, maybe they've had chronic gut issues and they've seen a naturopath 10 times, no testing has been done, and they're on 20 supplements. And I'm like, okay, what are we doing here? Like, there's been no kind of discussion. So it's really great to also, as a client or a patient, when you're going in to see a practitioner, to keep this in mind and to really ask, like, okay, what is the purpose of this? Why are we taking this? What is the intention here? Because obviously, when a patient is going in to see somebody who they look up to as a professional in the space, someone who's knowledgeable, they can trust. Unfortunately, I feel like sometimes they are just being sold hundreds of dollars of testing and supplements when it might not be necessary, or there are so many other things that can be improved on before they even touch that. So I love that you brought that up. Um,
Yes, and I'm a big fan of test, don't guess.
yeah,
So I would rather do some testing, and that doesn't always include the comprehensive like stool analysis or the urine analysis. I do a lot of blood work on patients. So it's just testing to see like what's actually going on. And I tell people don't do testing, especially people that are on birth control or anything like that. I'm like, there's no point in me testing your hormones when you're taking a synthetic hormone. It's not going to give you an accurate representation. Like, save your money, stuff like that. And when it comes to supplements, I actually take a lot of people off of supplements.
me too.
So if it, then like no shade to anybody in the industry that utilizes a lot of supplements. However, I feel like if someone is given a whole bunch of supplements, they have no idea what's going on.
Yeah.
I'm just going to throw a supplement at a symptom and hope, pray that it gets better. So I'm not a fan of that. I think maybe like 3 to 5 supplements max, like not even given at the same time, like core supplements to see what actually is working for a patient is good.
Yeah, and I think too, like what you mentioned, is clients will go on like 10 supplements at a time and then they have no clue what's working and what's not working. So you also get the case where people start on all these supplements and maybe they feel better. And then I start to see a patient and I'm like, how long have you been on these? 10 years. I'm like, whoa, like you've felt like this is the thing that's keeping me stable. And they stay on something even like adrenal glandulars for like 10 years they've been on them. I'm like, oh, is there no discussion about like that there
uh,
should be an exit strategy or what's kind of going on here? So I do think it's really important to also, educate the people that we're seeing of here's why we're doing this, here's what you might expect to feel when you start taking this, and here's when we would want to discuss coming off, and here's like the intended duration. Obviously, things can change, but really also educating people on why they're doing what they're doing. Because I'm sure you've seen this too, where you ask somebody like, oh, you ran this test, what came up? Well, I'm not really sure, but I kind of was like given this, or I think that this might have been it. I'm like, people don't even know. They're like spending so much money on supplements, testing, appointments, and they have no clue what's going on with their health, which is like crazy to think about.
yep. Yeah. And in the complex chronic illness world, sometimes there isn't a test that's going to tell you. And you just kind of have to make your clinical judgment and just go off of that instead of spending XYZ dollars in testing just to probably it come back normal, you
Yeah.
know? So yeah, it's a difficult space to be in. And sometimes you just need to accept that there may not be a lab that's exactly telling you exactly that this is what's happening. But we can see from that there's immune system dysregulation and
Mhm.
work with that.
Okay, so let's go back to histamine intolerance. We talked a little bit about some of the symptoms that one might experience, and really because histamines, nothing in the body happens in isolation. I say that in every single podcast, I swear. But especially when it
Mm-hmm.
comes to histamine, there can be a lot of systemic issues that people might not draw the correlation to. So we talked a little bit about the GI system. So we can have like bloating, diarrhea, heartburn, I see, food sensitivity reactions, specifically might be FODMAP foods even, or high histamine foods. We also see the immune dysregulation, so like watery eyes, running nose, congestion, swelling. Itchy skin is a really big one. That was one of my main ones. Again, chronic eczema. We talked a little bit about headaches and migraines, but what you posted about recently, and I also have talked about this before, is the relation to menstrual cycles and a
Mm-hmm.
correlation between a hormone we have called estrogen and histamine. So maybe you want to chat a little bit about how histamine intolerance can show up through a menstrual cycle.
Absolutely. So this is something I think needs to be considered in everybody that experiences histamine intolerance and also mast cell activation syndrome is the histamine estrogen connection. It is a vicious loop and cycle. And this could actually be occurring all throughout the cycle as well, especially if there's elevated estrogens present and not enough progesterone and testosterone to kind of balance and counteract that. So this can be seen all throughout the cycle, but I always ask if there's any point in the cycle when they notice it more specifically around ovulation when estrogen is naturally at its highest and then kind of tapers off throughout the luteal phase and progesterone takes over. But the loop essentially is that histamine gets broken down by the DAO enzyme, like we already mentioned, right? Well, the DAO enzyme can be inhibited by high estrogen. So if estrogen is high, inhibiting the DAO enzyme, then histamine gets built up. And when there's a histamine buildup, that actually stimulates estrogen to rise. So as you can see, it's a vicious cycle where we have high estrogen inhibiting the DAO enzyme, causing a buildup of histamine, and that histamine is causing estrogen to rise again. And we get into this vicious cycle and loop. And this is where we can see lots of those symptoms around the menstrual cycle, more specifically around like ovulation. But again, it depends on the person and their current hormone states. I've been doing lots of blood work lately and seeing low testosterone for both men and women. And I've been seeing occasionally the low progesterone, which is also an issue if people are trying to conceive and whatnot as well. But I always run them together because estrogen should always be read in combination with progesterone. And if people are low testosterone and low progesterone, we need to raise those back up, but it's not going to really fix things until we quench the flame of histamine. And that is the first step, what you should do if that whole cycle is happening. Because if we have a buildup of histamine, then that's going to cause a rise of estrogen. Even if you tried to clear estrogen with things like DIM, I3C, calcium D-glucarate, it's not going to work because histamine is always going to be there to impose it and also raise it back up. So quenching the flame with the histamine, like we've already talked about with possibly the over-the-counter antihistamines, as well as some mast cell stabilizers, would probably be the first thing that you would do. And then addressing the root cause of probably clearing out some of that excess estrogen. Now, this is where testing comes into play, because if estrogen is normal, like it's at a good, healthy level, but then testosterone and progesterone are low, it's going to give the illusion of estrogen dominance. And you wouldn't want to clear estrogen, because if you cleared estrogen, then you're just going to have low estrogen, low progesterone, low testosterone, and you're going to feel like garbage. So instead of clearing it, you'd want to raise it back up. And you can raise things like testosterone and progesterone. They're different, but you can definitely raise them with different botanicals. And that is the approach that the practitioner should take, in my opinion.
I agree. And one of my biggest hangups I talk about all the time is these generic, like, supplements that are called things like hormone balance, and they always have like DIM or I3C. And so you have women who probably have low progesterone because they're stressed, probably have low testosterone, maybe even normal estrogen, as you mentioned, taking these estrogen clearance supplements. And I've seen, clients be on them and they take them for like hormonal acne or whatever they're marketed for. And then you run testing on them and you're like, oh, your estrogen is actually low because you've been taking this, or it's normal and this is pushing it in the wrong direction. So hormone supplements, especially, I would never want to recommend a hormone supplement that's targeting something without actually testing where somebody's hormones are. And I think it's
Thank
wild
you.
that based on symptoms, because it's like you mentioned, you could have high estrogen or you could just not have enough progesterone. How do you know? You have to test. Like, you can't just assume based on symptoms. You can't just put somebody on estrogen detox. And what I've also seen a lot, like you mentioned, clearing estrogen is not necessarily going to help, because we also need to look at like, okay, well, is your gut health off? Do you have like elevations of beta glucuronidase? Are you not pooping?
Mm-hmm.
And now you're taking all this DIM, I3C, and you have all these harmful estrogen metabolites that aren't getting pooped out. And now we're making it a lot worse. So, like you said, we really need to understand the complexity of treating and managing based on the person as a whole, rather than like, oh, your estrogen looks high, you should just take DIM or I3C, which unfortunately has done a lot of women great disservices. But I love what you mentioned
Mm-hmm.
about it, being around the time of ovulation, because a lot of women feel like around ovulation, we should be feeling all of these positive things. I'm energized. I feel good in my body. I feel maybe like a little bit leaner and stronger. And I see so commonly is women who have what I call like PMS ovulation, where they're bloated,
Yeah.
water retention, migraines around the time of ovulation, which again, we need to look at things like histamine and liver support. around this time. But for the person who's listening to this, who does feel like in the middle of your cycle, and we say ovulation because we know as practitioners, but for women, it might just be like halfway between when you have your period and when it's coming again, you start to feel not great. And what I always recommend to people is when you have symptoms, start to write them down because as practitioners, we're able to see and recognize patterns pretty easily because we know,
Mm-hmm.
a lot more. But for a lot of women, they just think, oh, I have these random symptoms and wouldn't even necessarily realize that it's in the middle of their cycle or it's happening at certain times. So if you are somebody who's listening to this who has any chronic health conditions, I highly suggest just like print out a chart and start to write down when your symptoms occur, because that also helps practitioners be able to understand what's going on in your body as well.
Yep, I second that. We're on the same page, Sarah.
Okay, so we talked about, we've mentioned mast cell activation a couple times. So do you want to maybe mention what that is and how it differs from a traditional histamine intolerance?
So, like I mentioned with histamine intolerance, it's a problem with the breakdown of histamine, mostly looking at like gut health and the DAO enzyme. You can also like contribute like hormones and all that stuff as well to it and medications, like we talked about. But mast cell activation syndrome is where the mast cells excessively release histamine and other inflammatory substances to different various triggers. It can be from genetic mutations, infections, or other immune influencing substances. And you still want to look at the gut and you still want to look at hormones because the DAO enzyme is still very important because you're having an overabundance of this histamine. So you want to look at all the things that we also mentioned in histamine intolerance. However, stabilizing the mast cells and regulating the immune system is what's key for this condition.
Mm-hmm. And I think it's, again, also important to understand like you can have both at the same time, right? Your mast cells
Mm-hmm.
overproducing and issues with DAO breakdown. So, again, whenever we're looking at like treatments or helping somebody, we do want to consider all of these things. Is there certain blood work or testing that you would run for somebody who you suspect might have mast cell activation syndrome or histamine intolerance?
It's difficult because there isn't currently like from Life Labs or also Dynacare, there is no histamine, DAO, or any kind of blood test that you can actually run here in Canada. So that's why I was curious about which test you personally used to do for your testing.
I don't actually run them in my practice. I typically go based on like client symptom. We did do them as FDNs within our, like we had to run 5 labs on ourselves. But I also think that sometimes it can also be more so a symptom of some other stuff going on, which again doesn't necessarily need to be tested for. I'd have to look up what the lab is and I'll put it in the show notes. But it
Yeah,
essentially only
perfect.
ran those few markers and it was a few $100s. So for me, when I'm asking somebody to run testing, I always want to make sure that the test is going to either tell us something we don't know or change the outcome of what I'm protocoling or how I'm supporting the client. But as you mentioned, we can also look at a lot like client symptoms. Do you feel better on a low histamine diet? Do your symptoms improve? And if
Hmm.
somebody did want to test, like I've had patients and clients before who are like, I'm the kind of person who needs to see something on paper, then we run those things. But again, we're always opening up the discussion of like, if we are testing for this, what do we want to know? Can we see this through, trying to support like free dietary changes, see how your symptoms improve. So personally, I have not actually run it for a client, but I did run it for myself because we were required to.
Yeah. Okay. Well, that's cool. Yeah, I'm interested to know which ones that you do because currently at the moment there is no test that like can confirm it. It's very clinical diagnosis, and ultimately it's doing the exact same things that you mentioned. It's like changing up some diets, trying the antihistamines with a little bit of mast cell stabilizing, and then also like I would run all the hormones as well. I do that with anybody that has like the hive situation, even if they don't correlate it to any area in their cycle because maybe it's testosterone influence. It's not actually estrogen and progesterone, and we just don't have something progesterone and testosterone are stabilizing for the mast cells. So if it's that's the problem, then we also need to build that back up, and that can be men and women because I feel like a lot of people often only assume that the hormones are in relation to women. It's no, no, no. It could be men as well, and I've been seeing an overabundance of low testosterone in men, unfortunately.
Yeah, I think I've never really seen that much normal testosterone. You see probably like PCOS patients who might have hyperandrogenism, or a lot of women I'd say majority are coming back low testosterone, like on blood work, Dutch tests. And then we're also
Hmm.
seeing like, not going to go down this rabbit hole, but high levels of SHBG from a lot of women taking birth control for so long, which will also influence how much testosterone your body has to be able to use. And it really, I think, is under discussed of how important testosterone is as a female for
Hmm.
our overall health and vitality. We think of it as like a male hormone. And I've even had doctors tell clients, you don't need to test that. That's a male hormone. I'm like, what? Like,
What?
why do we
Yeah.
have testosterone then? If we don't need it, why do we have it? And also, like working with practitioners, like naturopaths are really incredible as well because have you ever seen the reference range on Life Labs? I think, I don't know if they changed it. It's 0 to something. I'm like, if a woman has zero testosterone,
Oh,
you cannot have zero testosterone. So why is the like bottom end of the range literally zero? It's
yeah.
crazy.
On Life Labs, it's well, it depends on which testosterone you're looking at. But I think the reference range is just less than 1.8.
Yeah.
So, and then what I've been seeing that's been coming back low is it'll be shown as less than 0.4. So I don't know what that is. I don't know if it's 0.3. I don't know if it's zero. I have no idea what it is. So that's low regardless. So
That's kind of interesting because in BC, I had one come back yesterday that was zero point 0.1. So they actually will show you like zero point
oh,
0.1.
it might be different from different provinces
Yeah.
then. I'm not sure, but yeah,
Okay.
still
So
a
let's,
problem though.
yeah. So, bro, you do not want your testosterone to be measuring at a zero point 0.1 or zero point 0.4.
No.
Okay. So let's talk a little bit about the liver health because I feel like in the functional space and when you follow like, functional practitioners, everybody's talking about supporting your liver. I consider this really like foundational. I put it in all of my foundation programs. So, what role does the liver play in histamine intolerance?
Yeah, so when you think of this also in traditional Chinese medicine, when the liver is always involved when it comes to like itchiness, which is interesting. You also need to think about that in regards to like detoxification, right? So it's phase one, phase two, liver detoxification. Phase one ultimately takes the molecule and oxidizes it, that makes it into a free radical. And then phase two takes that oxidized molecule and actually processes it and gets it out. And then air quotes, phase three isn't involved in the liver and that's pooping it out. You mentioned beta glucuronidase. That is in regards to like estrogen metabolism. It's produced in the gut and influences liver metabolism. And you can see that also with like a little impaired liver function. Calcium deglucarate is one of the best things to decrease beta glucuronidase and also to help like kind of push that around. I've used that in patients with Gilbert syndrome and all those things where they had the particular gene mutation. And that's actually can be more common than not, the Gilbert syndrome, where you can see inadequate drug metabolism, where if they're taking NSAIDs or acetaminophen, where it lasts a little bit longer in the body, and that can cause some histamine problems and influence the DAO enzyme. But ultimately, when it comes to liver, like you just want to make sure that everything is moving smoothly. Because if the body is trying to process everything and it's creating these inflammatory markers, then we don't want it to become air quotes sluggish. When the liver becomes air quotes sluggish, then we can't process our nutrients, we can't process drugs, herbs, botanicals, vitamins, minerals. It doesn't just do drugs, it's everything.
Mm-hmm. And I think it can kind of be a slippery slope for some people where then they'll start taking a buttload of supplements more to start to be like, oh, I'm supporting my liver, and they're taking, all of these supplements. And personally, like I really like to focus on gentle detox practices for people. So things like, Epsom salt baths are really great. I love castor oil packs, even just like moving your body. I know that you're a big fan of doing rebounding and moving your lymph.
Yeah, whole
Follow
body
Ashton on
vibration.
Instagram and you can see her doing her little vibrations on her stories. It's so cute. I really like these practices and even drinking things like, dandelion root, nettle. These are all going to be really incredible nutritive tonics for supporting liver health. And
Mhm.
it's really easy for people to want to like hop on again a buttload of supplements, but also understanding like your liver still has to process those. Even something like a tea, it still will process that. But really including a lot of these gentle practices for people can be so incredibly beneficial. And especially in patients who are more sensitive. Like somebody who has something like mast cell activation syndrome is typically a patient who is quite sensitive to even treatments. And really starting with like gentle sauna, castor oil packs, I find can be really big needle movers that actually allow a lot of patients to tolerate treatments much better than just giving them a supplement.
Yeah, and you need to be cautious with mast cell activation syndrome because things like heat and vibration can actually trigger it. It's very specific with the immune system, so it just depends. Because with whole body vibration, it ultimately increases lymphatic flow, increases blood circulation. It brings it to areas that normally may struggle to get a little bit more of that lymph and blood there. So I've had mast cell activations patients that have done the whole body vibration and they got on it for maybe 2 minutes and then it stimulated, they had whole body hives because it just increases the blood circulation. And then if there is histamine, like I mentioned, it increases cell permeability or blood vessel permeability. And if the blood vessel is a little bit more permeable, it may possibly leach into some of the interstitial fluid and therefore creating an immune response. And then we get hives, we get swelling, things like that. So heat, cold, so hot and cold, that's where we get cold urticaria, right? So that's hive induced from the cold exposure. And then same with heats can also cause hives as well, vibration. You just need to be really cautious with these things, even though they're healthy. Like we mentioned, even with the diet, even though they're healthy, they may just need to be slowly introduced and also worked on so that we can tolerate them again.
Okay, so this is going on a little bit of a side tangent, but because we've mentioned hives a few times, I have seen, and we can cut this out if we can't talk about it. I have seen so many people who have come to me since the COVID, you know what's, have rolled out who got chronic hives from it. I also run HTMA tests in my practice, and I have seen a lot of buildup of mercury and aluminum since this has
Mm-hmm.
happened as well. So my clinical thoughts are that a lot of people are getting hives post-vaccination, potentially due to like heavy metals, but I'm also interested in just the impact it has on the immune system and maybe mast cells as well. So is that something you've seen over the past
Mm-hmm.
couple of years?
I don't know if my governing board would love me to talk about this, but because we can't talk about vaccines, that's why.
Right.
I have definitely have an opinion on them. In regards to heavy metals, yes, absolutely, the body can create an immune response based off them. That's why they include them in those immune modulating substances to as an adjuvant. That's ultimately what's used to stimulate the immune system to and then bring it over to that substance to recognize it and then create a memory B cell and create an antibody to it. But ultimately, it is because of the heavy metals. And the heavy metals absolutely can be a potential cause of mast cell activation syndrome. So, with you mentioned the hair tissue mineral analysis, that could be one thing. Also, doing a heavy metal urine sample after a sauna with possibly a chelating agent is a really good way to tell what's kind of in your system, and then retesting after you do any binders or anything with the heavy metals and monitoring symptoms as well. We live in a very toxic world. We live in a very toxic world. If you live on planet Earth, you're exposed to heavy metals, just the way it is. And then depending on what you do for work, if you're a hairdresser, if you're a welder, if you're a nail technician, you're going to come in contact with them even more so. So that's something I definitely consider when there is these chronic, strange, bizarre symptoms that nothing seems to really touch them. Definitely look
Mhm.
at the heavy metals for sure.
Yeah, it was quite interesting too because I had a client who had a lot of strange symptoms and we ran her HTMA and it was arsenic just through the roof. And it was a
Mm,
specific area of around where I live where every person I had tested from this area or I've known to even do HTMA, like a couple people have all had high arsenic. I'm like, it must be in the water. Like, so
it
really
might
like we
be.
are, yeah, we are exposed to so many heavy metals and toxicities. And again, I think this is why, like you said, for chronic cases, it's typically not just one thing. Like we really need to take each patient and understand them as a whole, because it's like we said, okay, well, we can't just address histamines without looking at gut and without looking at your hormones. And so, working in the functional space or alternative, with like even naturopathic doctors are still kind of considered alternative, or just practitioners who really look at it as a whole, truly is the future of chronic care. Because where conventional medicine fails a lot of people, it's one pill, one ill. They need something on a lab to give you something, which again comes from like insurance and just what they can do within their scope of practice. But truly, what is changing lives for people with chronic illness or bizarre symptoms that nobody can figure out is this view on patient care that is more integrative and looking at the person as a whole.
No, I totally agree. And it's really interesting that you saw that in a particular community. We can see that a lot too, like a lot of barium, a lot of aluminum, things like that. That's really interesting. Also, arsenic's really rich in like things like brown rice. So depending on like
Mm-hmm.
what their staple foods are, you can kind of keynote and like narrow it down to where it comes from. Another thing too that I commonly see is aluminum or anything like that. Dry shampoo, ladies, no.
Yes.
Batiste, no. I'm sorry to break your heart. There's talc in there. There's a lot of weird chemicals and heavy metals in there. Just there's other alternatives. And I know it's so convenient and it smells good and it works good. So it's hard to give up. But Batiste, we got to give it up.
You make your own, get some arrowroot powder, put it in your roots,
Yep.
wash your hair.
Yep.
I agree. And
Exactly.
I think for sometimes, again, this is why like testing can be helpful, is sometimes in order to elicit change, when you are able to show clients something on paper and be like, bring up the discussion like, hey, your aluminum's quite high, do you use deodorant that you're rubbing aluminum right into your lymph nodes, into your pits? Are you using things like Batiste? And then it really can elicit change versus just sometimes when we say these things to people, it's like, yeah, but the convenience of, using dry shampoo. But when people are actually able to see things or feel a difference that it can make, it's really powerful for eliciting behavior change.
Totally. And also, you have that quantitative data that you can retest to affirm them that what you're doing is working.
Mhm.
Yep.
Okay,
So
so we're going to
retest
do a
is
little
huge.
recap
Yes.
here. So, talking about histamine intolerance, this can come through as a lot of systemic issues. So, bloating, diarrhea, heartburn, food reactions, itchy skin, dry eyes, swelling, anything that you would consider an allergic reaction, skin rashes, migraines, PMS, even like heavy painful periods, all the symptoms of high estrogen, which we didn't really talk about. So, painful periods, acne, water retention, mood swings, all of these can come through as a are influenced by rather histamine intolerance. And then if somebody came into your practice, you were pretty positive they had histamine intolerance or mast cell activation syndrome, go through, we touched a little bit on it, but just how you would help support that person. So maybe like talking about dietary changes, herbs, and then anything else you would give them as advice.
Yeah. So if you're somebody that's suspecting it, like go find a local practitioner that focuses in this area because they will say if they do or not. And also it's like, yeah, dietary changes, like we mentioned, the low histamine diet. And that doesn't have to mean full-fledged antihistamine diet. Look at your diet and see if there's any foods on there that you eat pretty regularly. Go about 2 weeks or so without those main foods that you see on the list that you eat regularly and note how you feel. Write it down. Keep a journal on your experiences, whether that's headache journal, whether that's skin hive issue. Keep a journal on it and bring that to your practitioner. It's really going to help us. So focus on diet first. See how you feel. And then when you go and see the practitioner, there's other testings that you can do. You can check your hormones. If it's about painful periods, it may not be correlated. Your gut health versus whatever. You can do comprehensive stool analysis. You can do try and eliminate inflammatory markers, like if there's lactose sensitivity, if there's gluten sensitivity, that's some of those big ones that are scary for a lot of people to take out. You can focus on your digestive health and see if things get better. If they don't, try possibly some over-the-counter antihistamines. That gets rid of your headache, that gets rid of your painful period. May not seem like it's quite relevant, but that is also very good information for us to know. Now do that safely and do that under the care of a practitioner if possible, and then consider some potentially mast cell stabilizers, like I mentioned, the EMIQ quercetin, nettles, high dose vitamin C, perilla, things like that. Then once you got your blood work done, with your practitioner, looking at your hormones, or whether that's your comprehensive stool analysis or whatnot. If there's any chronic infections, heavy metals, your practitioner, based on your presentation and your history, will choose the best route for you and what they think is the best thing to get assessed. Once you do that and they get the results back, whether it comes back there was something or there wasn't something, we reassess and go from there. So if it's hormone related, again, it kind of all comes down to quenching the flame of the histamine first and then treating the root cause. That's my advice.
I love it. And where can people find you? So Ashten practices in London, Ontario. Are you able to service clients all over Canada? What's the regulations around servicing clients?
Yeah. So I know you're out in BC. I can only unfortunately see patients in Ontario. So that is any residents to Ontario, unless you physically come and see me, then I can see you. I service virtually and also in person. I'm at Spine and Joint Associates, which is in London, Ontario, for in person, and then I do virtual telemedicine all across Ontario. So you can come see me there. You can also come and reach out to me on social media if you have any questions about what I do, or just seeing if I can point you in the right direction or find you a practitioner that may be able to help you in your area. So reach out to me on Instagram, TikTok. I also have a Facebook page. It's dr.buck.nd, and you can find me there.
She's one of my favorite Instagram accounts. I actually don't really watch that much content that people put out, but I always watch Dr. Ashten. She is so cute on her Instagram and has so much valuable information. I learn a lot from her page, and I know that you all will love her as well. So thank you so much for coming on our podcast. I'm excited for our next chat, which is about a topic that both of us have gone through, mold toxicity and mold illness. So really excited to have you back on the podcast. And thank you so much for sharing your wisdom.
Well, thank you so much for having me. I'm looking forward to round 2. So come back and buckle up, because this is the juicy topic that's coming up next.
Thank you so
Thanks,
much.
Sarah. Bye.